I'm Nathan Herman. I'm a geriatric psychiatrist here at Sunnybrook Health Sciences Centre, and I'm a professor of psychiatry at the University of Toronto. And I'm going to be talking to you about COSID, which is the Canadian Outcome Study in Dementia. It was a 3-year longitudinal study that looked at over 900 individuals from across Canada with mild dementia, about 600 of which had Alzheimer's disease. And we followed these individuals for 3 years using a variety of different investigational tools. We followed them for things like the degree of memory impairment and other cognitive difficulties. We looked at their activities of daily living, their ability to perform certain daily activities of living, and their behaviors, any kind of problems they may have had, such as depression or apathy or agitation. And then we asked caregivers of these patients to estimate how much it cost to look after them. And we looked at things such as the actual costs of medicines and physicians' visits and hospitalizations, as well as the time away from work or time away from leisure activity for the caregivers. We found that it was very expensive illness, and that the costs of looking after patients with Alzheimer's disease, even those in the community who started out with mild to moderate disease, increased dramatically as the disease progressed, as it got more severe. And that's as it got more severe with respect to their cognitive impairment, and as it got more severe with respect to the activities of daily living that became impaired with the illness.
I'm Dr. Krista Langto. I'm a senior scientist here at Sunnybrook Health Sciences Centre. I'm also a professor of psychiatry and pharmacology and toxicology at University of Toronto. We found an astounding increase by severity. If you look at the cost to take care of one patient with Alzheimer's per year and compare the mild to the more severe stages, in the mild stage it costs about $4,000 per year. But when you move to the most severe stages, it moves up to $48,000 per year, so 10 times higher and almost $50,000 per year. The major cost driver when you get to severe is actually unpaid caregiver time or indirect costs. So this is lost productivity from the caregiver who has to take care of the patients. The major portion of that is when the patient loses their ability to do their basic self-care.
In previous studies, it was found that one of the most important factors that contributed to costs associated with Alzheimer's disease was the cost of institutionalization. So we wanted to exclude that and just look at what the cost was to people living in the community.
We think by the year 2035, there's going to be over 1 million patients in Canada with Alzheimer's disease. It's already one of the most expensive diseases along with stroke.
A lot of the costs of the illness in this country are being paid for by caregivers and not by government, not by society. It's directly out of the pockets of the caregivers themselves.
The caregiver really needs to have more supports in place. The disease becomes more expensive, but we really have to put more towards community supports for the caregivers. The second important point is that we really need to find treatments that can delay progression. If we can delay progression by 1 or 2 years, we can really make a major impact on this disease.